Hey there, my name is Bailey O'Brien. I'm a stage 4 melanoma survivor and cancer coach if you don't know me or if you haven't seen me before. And today I wanted to do a live group coaching session on the HHV-6 virus, and I accidentally forgot to press record. So this is a re-recording of this presentation about a virus that's one of the human herpes viruses. And I started researching it for a family member who has an autoimmune disease because a friend of the family had read an article saying that you need to get this, well, basically saying that HHV-6 can cause a lot of problems in autoimmune diseases and just in the body in general and in multiple different organs. So had to look into it, found a lot of interesting information. Not sure, you know, how much it's going to come up in the future, but it's good information. So I wanted to research a bit more about its possible connection to cancer, and so I'm going to talk about that in this presentation. But if you don't want to watch the whole thing, basically there's not a strong correlation or causative factor proven to be associated between HHV-6 and different types of cancer. It is highly associated with cancer. It's more common in people with cancer than people who don't have cancer, or infections actually. But it's, if you want to learn more, keep watching. And so the first slide is about the history of HHV-6 and a brief overview of it. It was first discovered in 1986, and in 1988 it was found to be the cause of roseola, also known as 6 disease, which is basically you get a fever for a few days and then end up with a rash at the end of those few days. And most people by 2 years old have gotten it. It's considered mild, even though you could have a high fever from it. It's nothing too dangerous unless the fever spikes really high, then you would want to call a doctor about it. But you can learn more at this website provided in the slide. And most people have antibodies for it by age of school. So if you get you're basically immune to a second infection later on in life. But if you do get an infection later on in life, rather than earlier, it's not necessarily a bad thing, not like the chicken pox where if you get it younger, you're going to be fine. If you don't, then you could end up with shingles later on as an older adult, and that's more difficult to handle and treat. So it could be harmful to people with compromised immune systems, such as organ transplant recipients. You can develop other infections, but that is just something to be aware about. There's no vaccine for it, and it's communicated through saliva in general. So more about the incidence of HHV-6. There's this article called Persistence of Vertical Transmission, where basically it's acquired in childhood as an infant or a baby. 1% of people can get it from their parents. Either one parent has it or another, or both of them have it, and then it gets transferred to the person. It accounts for 10% of ER visits due to fevers in children under 3 and 20% of children ages 6 to 12 months. It can also hang out in your bone marrow inactive. So you can test positive for HHV-6 but not have an active infection. It can stay there the rest of your life and not cause you any other problems. So here are some medications that can worsen an infection if you have it. On this table, I'm sorry I didn't get the link for the article that it came from, but probably the article link is somewhere else in the presentation. So here are drugs associated with either reactivation of the virus or enhanced replication of it, so you're going to get a heavier viral load from these medications. So we have HDAC inhibitors, which are mood stabilizers and anti-epileptics. Have trouble pronouncing that word. So protecting against seizures. It can, amoxicillin is another medication that may exacerbate it. hydrocortisone, which is an immunosuppressant. So immunosuppressing drugs can worsen the HHV-6 infection. Sulfasalazine can exacerbate it. An anesthetic called trichloroethylene, an antiarrhythmic called mexiletine. Forgot that one in my bullet points. Anticonvulsants, there are several listed there. And then allopurinol, which is used to treat gout or kidney stones and used to decrease uric acid in people with cancer. So who's at risk for developing an infection? Well, it's mostly in people who have a compromised immune system, and particularly in people who have received organ transplants because they are receiving medication that is compromised or suppressing the immune system. And then the transplant organs may have the virus as well, so it can be transferred that way. And here's an article about children who received a transplant and they developed encephalitis. So that's one further infection that you could get if you already have HHV-6 and you have a compromised immune system. So my audience, you might be probably here to learn more about cancer. So I wanted to research a bit about it and its prevalence in cancer. And it is found in a lot of different types of cancer, not like every type of cancer, but it's pretty common in, for example, in ovarian, triple negative breast cancer, glioma, stomach cancer, colon cancer, even breast cancer, as we'll see later. And if you want to learn more information about that from the HHV-6 Foundation, which has a lot of information, it has many articles on cancer, and so that's where I got some of this information. If you want to learn more about it, you can check that out. It also is interesting because if you have an HHV-6 infection, it can actually give you a false positive result for lymphoma if you biopsy a lymph node. So that's interesting, just keep in the back of your mind there. And then it can also contribute to fatigue if you have cancer. So I'm going to talk about a couple different articles that I found relating to HHV-6 and cancer. So this one is called Viral Sequences in Human Cancer. The link is right there for you. So there are 5, I added a 6th one there, but there are 5 viral families prevalent in human cancer. The first one is HPV, human papillomavirus, which is found in about 98.8% of cervical cancers. HPV, again, is found in head and neck cancers. Hepatitis B and C have been found in liver cancers. HPV and BKV, which is BK virus, are in a small subset of bladder cancers. HHVs, human herpes viruses, are in many different cancers. And then in an article, I found that EBV, Epstein-Barr virus, is found in about 20% of stomach cancers. So here's another article, Human Herpes Virus 6 and Malignancy, a review. Again, the link is there. So basically what this article is saying is that HHV or HHV-6 is present in certain types of cancer. It's pretty common, but it doesn't mean that it's causing cancer. And if you look at the last sentence here, it says another possibility is that it might be an opportunistic virus that thrives in the immunodeficient tumor microenvironment. So let's say you have a tumor, you don't have a lot of immune system activity around it, or you're generally immunocompromised. That may just be due to a variety of factors, and you develop cancer as a result of your immune system being compromised. The HHV-6 virus may be present because of your suppressed immune system as well. So you can have cancer and HHV-6, and they may stem from one place of immunodeficiency. So it doesn't mean that HHV-6 is causing cancer. It may just be stemming from the same place, if that makes sense. So it's just it could be a coincidence that they are, or not really a coincidence, but not really a cause and effect relationship between HHV-6 and cancer. Hope that made that kind of clear or clear for you. Okay, so if someone believes that the virus causes cancer, they may believe so because the virus is present in a lot of cases of cancer. It's present in most tumor cells, and it actually may act as a contributory factor that indirectly enhances tumor cell growth. So it may make cancer grow further. And in some cases, by cooperating with other viruses, I believe it was HHV-4 and Epstein-Barr virus that made a cancer grow worse, something I read in one of the articles. And so viruses put together can have a negative synergistic effect, unfortunately. So when you have more viruses, it's going to worsen your health status or cancer status. Okay, it's also been associated, taking a break from cancer, HHV-6 has also been associated with several different autoimmune disorders or diseases. And I got included the link. Here's an article called Possible Role of Human Herpesvirus 6 as a Trigger of Autoimmune Disease. The jury, it hasn't really been proven that HHV-6 causes these immune diseases, but it may play a role in it. So some of the autoimmune diseases that it's been associated with are connective tissue disorders such as rheumatoid arthritis, MS, which is multiple sclerosis, Hashimoto's thyroiditis, Sjogren's syndrome, purpura fulminans, which is a thrombotic disorder. So you get coagulation of the microvasculature, meaning small blood vessels, and that rapidly progresses and leads to skin necrosis or skin breakdown and death. It's also associated with severe autoimmune acquired protein S deficiency, which is another clotting disorder, severe and acute autoimmune hepatitis, and autoimmune hemolytic anemia, where your body destroys the red blood cells at a rate that the production of red blood cells can't keep up, and then also neutropenia, so low white blood cell count. So if you'd like to get tested because you may suspect that you have an infection of HHV-6, you can go to the link there. There are different testing options, and what I found that seemed to be the best is the quantitative PCR, which is the excuse me, fifth, or if you count all of the bullet points, it's the sixth one technically, but it's a fifth testing option on this slide. So the quantitative PCR of whole blood seems best. You can get it through LabCorp. There are other labs you can get it through, but testing the whole blood seems best. So the quantitative PCR of whole blood test seems best because, first of all, quantitative, you want to know the number of the viruses present in a certain amount of blood, because you can test positive for HHV-6, but it can be latent. It can be not causing you any problems. But if you have an infection, the number of the viruses or the virus DNA is going to be much greater. So you want to know not just if you have the virus, but if you have an infection of the virus. So you want a quantitative test, whether you have a tissue biopsy or a whole blood or plasma test. So, and then whole blood is important because, well, you have, let's say you give blood for a blood test, they're going to take your blood and centrifuge it, which means that you put it in a tube into a machine that spins it really fast, and then you separate out the cell contents from the cell plasma, the liquid part. So the whole blood test seems to be most accurate. And then, there are other tests you can get done, PCR, DNA tests in the plasma or serum. That seems to be accurate or predictive in detecting an infection. You can have a quantitative tissue biopsy, so you can actually look at a biopsy under the microscope and count the viruses, which is pretty amazing. You can also get an immunohistochemistry test, which is basically staining tissue. I wrote sessions, but I meant sections from biopsies, so you can stain the tissue and they can detect it that way. And you can get an IgM test, which is an immunoglobulin M test, so to see if you have antibodies for that. And then you have IFA IgG test, so that's another antibody test, just using a different technique called IFA, which is indirect immunofluorescence assay, or assay. I don't know how to say it. Okay, so not only is there HHV-6, the regular HHV-6 virus, and actually there are two different types of HHV-6, there's A and B, but there's also chromosomally integrated HHV-6, which is basically where you have a copy of the DNA of the virus in each of your chromosomes, and actually more specifically in the telomeres of the chromosomes, so at the very end of it. And so this is actually found in about 1% of people in the US and the United Kingdom. It can be inherited from a parent or both parents. And so the tricky thing with this is that it can excise itself. So basically it comes out of itself, basically come out of the chromosome and cause an infection that way. Usually it's activated under circumstances where the person's immune system is compromised, like immune deficiency, or you're taking drugs that suppress the immune system, like I mentioned before. It can actually become activated by chemotherapeutic drugs. There's an article here talking about a patient who in Boston was found to have the infection after getting a drug called vorinostat, however you say that. So if you need to get testing for this, you need a whole blood analysis, as I mentioned before, and you can look at the website listed below for how you can get it tested or where. And then another thing to know about this version of the virus is that it can increase your likelihood of getting graft versus host disease, which happens when you get an organ transplant. It's basically where your body attacks the organ. It rejects it, and you get really sick over it. It can also increase your likelihood of bacterial infections after an organ transplant. So it's not a good thing. And let's see, I think, yeah, so I didn't mention before, but if you have an organ transplant, a person can, what increases the likelihood of infection when you have an organ transplant is, one, the drugs that suppress the immune system makes you more vulnerable to infection, and then second of all, the organ itself can have the virus in it, so that combination can make it worse. And actually, going back to the cancer slide, I forgot to say this, that also HHV-6 was found in, or maybe it was HHV-6, I'm sorry, I forgot, that people who did not have cancer, they had an incidence of 0.9% of the virus, and then in people with cancer, it was 1.4%. So it was more likely to be found in people with cancer. And again, it doesn't mean that it causes a cancer, just that it happens to be there at the same time. So if, let's say you have an infection, what can you do about it? There are antiviral drugs that you can get. There are these conventional drugs. Some of them are listed in an article on a person who is 20 years old and developed the infection, HHV-6, and then she had the first drug, then she had to stop it, then she started the second drug, the one starting with a G, won't try to pronounce it, and then she had remission of the infection. And then the last two are actually from the first link, from the HHV-6 Foundation. Those are antiviral drugs that you can take. Then for natural alternatives, there's the anti-malarial drug artesunate, which is actually not a drug, it's a natural compound, but that can possibly be helpful. And then, so autoimmune diseases I mentioned before, such as MS, there was a person in the first bullet point about the Gerson therapy, there was a person who had the HHV-6 virus who also had MS, and she healed using the Gerson therapy. Then there's someone else who had MS, who at that link, actually the link shared information on how you can reverse MS with certain dietary changes. And I don't actually really agree with all of them. They're not, they're quite different from the Gerson therapy. There's a lot of animal protein in it. And like some processed foods that it just doesn't make sense to me. But there are people, a lot of comments in the comment section where people shared their healing stories and how diet and other things help them to reverse their MS. So just interesting tidbit there for you. Also, you can take antiviral foods like garlic. Garlic is very antiviral. You can have it as often as you want. There won't be any negative side effects except maybe scaring people away from you. Or, well, if you, let's say you juice it and you drink it, you can have too much at once and you can feel really sick. I did that once or twice. Whew, yeah, it's strong stuff, really strong. It's God's pharmacy. So that's really good. According to the medical medium, there are other foods there that should help to heal from the herpes virus. That's pretty much it. So HHV-6 virus, it's very common, but mostly very, very undangerous, if that's a word. So it's not something that you probably have to worry about, but hopefully you feel educated now and empowered on what to do if you do get an infection or you suspect it, how to test for it, what to take for it, and if you have cancer, maybe there's a correlation with it, but it may or may not have contributed to the growth of your cancer. And you are empowered, you have options, you can do what you like with it, and there are both natural and conventional substances you can take for it. Of course, if you know anything about me, you know that I would prefer the natural version first, and probably you too, to avoid any potential negative side effects. But you are the boss, and so you have to research, pray about the information that you find, and I pray that if this is related to your situation, that you will find healing and comfort and power with the knowledge that you acquire. So thank you so much for watching, and I hope that you'll join me on the next one.